Hello, it's Dr. Eric Potter, Functional MD from Sanctuary Functional Medicine, back for another Facebook Live. I hope everyone is enjoying this wonderful fall weather, fall weather we're having. Yes, it's cold here in Tennessee, but you may be listening in, watching from somewhere else. Regardless, I hope you're doing well, getting ready for our holiday season. With that, as you're coming online, just to make sure that everything's coming in loud and clear, give us a thumbs up or some kind of signal that you can hear me well before we get started talking about mast cells, a little cell in our immune system that can give us a lot of trouble. So with that, as always, let me give you a little introduction to what we're going to do, probably for about 15 or 20 minutes. I'm just going to do a little introduction to what mast cells are, what they do, how they may be affecting your health, and with that, give you a good overview. After that, I have a few questions that people have already submitted online. There will be opportunities to answer other questions if you have them. Send them in, and I will do my best to get to as many as possible in the next 45 to 50 minutes that we have. So with that, we're going to talk about mast cell activation disorder. First of all, you really need to know what mast cells are. Mast cells are a type of immune system cell. Our immune system is what defends us against invaders like bacteria and viruses and so forth. With that, we have a whole variety of those cells and interacting in a system in our body to prevent us from being overwhelmed from a virus or overwhelmed from a bacteria, parasites, fungal infections. But each cell has specific purposes. Lymphocytes do one thing, macrophages, neutrophils do something else, mast cells do different things, eosinophils, basophils. These are just some of the names of cells in our immune system, and they communicate with different messengers, mostly called cytokines, but there are growth factors, there are interleukins, there are interferons, a lot of different ways that they talk to each other to let each other know what they think the other one needs to do, whether it's come over here and help or everybody calm down, the infection's over. So with that, we have a very complicated system that a good way to think about it. When I was in med school over 20 years ago, the book for immunology was about this thick. Looking at recent one, it's more in that thick range. We have learned a ton in that 20 years about how our body protects us from the outside world and also avoids attacking ourselves. So with that, we're going to focus down now on a single cell called the mast cell. A mast cell is a type of cell in the immune system that basically lives in one area. It is not a traveler like T and B lymphocytes or neutrophils are in our bloodstream, where they travel from one place to another wherever the need arises. Mast cells, they're a little bit more, once they settle in, they're staying in that tissue, typically on surface areas. So mucous membranes in our sinuses, in our bladder, in our GI tract, in our skin, places that come into some type of contact with the outside world. As they live there, they kind of set up a sentry post, a outpost, scouting for any potential inflammation, any potential invaders, anything that might cause some problems. Whenever they do sense, oh, something's going on here, there's inflammation, there's invaders, they're going to send out messengers. They have a lot of messenger types in their toolkit. Initially, we kind of considered that they were more of just sending out histamine, but over time realizing there's probably 50 or more different messengers they send out. What do these messengers do? They are going to help notify other parts of the immune system that there's either a need for neutrophils, for increased blood flow, and for other things, other cells to come and help fight. That's where the ground war is going on. When they do this, like I said, they can trigger inflammation, so you'll see redness. You'll see swelling from that inflammation. There's more blood flow. There's more fluid leaking into the tissues. where those mast cells are related are found. So when that happens, that blood flow brings more blood, it brings more cells from the bloodstream that are lymphocytes, and they start saying, oh, hey, there's a high concentration of this messenger. That's a kind of a red flag. We need to get out of the bloodstream and hop off into the tissue. Something's going on. With that, then you start seeing more other things, whether it's the inflammation like abscesses, whether it's just itchiness symptoms that are left over from histamine or other things. So they're really an important part. If we didn't have them, we wouldn't be able to respond to infections and invaders quite as easy. However, we're not here to talk about how they do their job, although that is very important. What we're here to talk about is how they do their job poorly. So how could such a wonderful little cell that's helping us so much end up creating such havoc in many of our patients? Well, yes, many of our patients do have something called mast cell activation disorder or mast cell activation syndrome. Now, what that really means in its simplest terms is these mast cells, not necessarily greater in number, that you're not overgrowing them like a cancer, but they're just hyperactive and they're very sensitive. They're more likely to release chemicals. They're hair triggered rather than waiting until they see real danger. They may start responding to things that aren't dangerous. Anything from temperature changes to barometric pressure changes to light touch or other chemicals that you put on your skin or that you eat and they react in your GI tract, or that you're inhaling in your sinuses, or happen to be things that happen to be passing through your bladder. So with that, okay, hopefully everyone's gotten back on board. We had a little glitch. I'm not sure exactly what happened, but regardless, I'm going to try to pick it up where I left off. Yet I am going to give everybody at least 10 or 15 seconds here with me just kind of rambling on here about who knows what happened, so that you can get back on board and hear what I was saying about mast cells. So if you're just getting on board, I'm going to be talking about mast cells in the middle of telling what they are, what they do, and now how they can go wrong in their function and affect our health. So I was talking about mast cell activation syndrome or disorder, in which mast cells start releasing their chemical mediators, their messengers to the rest of the immune system, calling in the forces to local tissues where they reside when they really shouldn't be. And that can be, again, to something that's as simple as cold, hot, barometric pressure changes, a food that you're eating, a simple touch causing dermatographia where your skin gets hives, just someone scraping it too hard. It can also cause some other symptoms because they are also, I did not mention, found in the brain and can cause some neurologic symptoms like migraines or even some pain syndromes. So with that, let's talk about why do those cells start having such trouble? Well, normally they're functioning, as I mentioned, to ward off invaders, calling in the immune system to attack when needed. However, if they are not functioning, they have hair triggers, so rather than needing to be pushed this far, they only need just a little tap, and all of a sudden they release a bunch of mediators in higher numbers. So that's one of the things that we need to remember. This is distinguishing from a disease that even conventional medicine realizes, called mastocytosis. Mastocytosis is more of a type of a tumor in which you have an overgrowth in the number of cells, whereas mast cell activation disorder or syndrome is more just an overactivity of a relatively number, maybe slightly elevated, but mostly relatively good number of cells that just are very touchy and release a lot of chemical messengers. So when they do that, they often do that prolonged, and rather than turning things off and stopping their messengers, once that trigger is gone, they keep shouting and shouting more and more and more, and they cause more inflammation. And some of those symptoms can go on and on. So it is a normal process gone haywire that, again, may be triggered by a number of normal stimuli, things that are potential triggers in the environment that shouldn't really cause a problem, and some of the symptoms they can cause. Let's just walk through that. I don't think I've fully listed all those yet, but let's head to toe. Mast cell, if you're releasing a lot of histamine, can trigger migraines, or if they're releasing those in the nervous system where we do have some mast cells located, you can get migraines, you can get some auras, odd symptoms, dizziness. You can also, if in the peripheral nervous system, a lot of histamine can cause some numbness, tingling, stinging, different pain syndromes that don't make sense. Most people know that histamine in the sinuses, you can get some sinusitis, blocked nose, runny nose, some coughing as you're triggering in the lungs, itchy, watery eyes. People also know the histamine on the skin released there can trigger hives where you're breaking out in a rash, very itchy. But you can also, since you have mast cells in the lining of your gut, you can have symptoms there. You wouldn't see them because it's on the inside, but they could cause some nausea, cause some diarrhea, cause increased secretions, so you're having kind of secretory, watery diarrhea. It can cause the gut to slow down, could just cause it to hurt, have some swelling, discomfort, bloating kind of sensations. It also, if it's occurring in the bladder, as some chemicals go through there, or just your normal urine, something called interstitial cystitis, where you have inflammation that's not an infection, and it's not really toxic, but it's an immune reaction in your bladder that can cause pain, just like a bladder infection, but your urine cultures all tend to be normal. So those are a number of the symptoms. Also, given the neurologic system is involved, you also can have some anxiety, panic attack spells. It can affect your mood. So those are just a few of the ways mast cells may cause problems if they are misbehaving in your system. Now, what might trigger a mast cell to have an issue? We mentioned that thing called mastocytosis, which is more of a tumor growth and overgrowth of cells. That's typically a genetic thing where there's some genetic changes that put people at risk. Those are pretty unusual and pretty rare instances. However, mast cell activation disorder is probably a lot more common, more prevalent than most people would realize. It doesn't need necessarily a genetic, although there are a few genetics. If you do not do well breaking down histamine, say with an HNMT SNP, single nucleotide polymorphism, you may have a normal activity in mast cells, but because you're not getting rid of their messengers as fast as you otherwise should, those messengers stay around and keep causing problems, causing inflammation. Now, you combine that slow breakdown with overactivity, and you even have worse potential for symptoms occurring in a person. So you can have genetics. Your DAO enzyme, which also breaks down histamine, may not work as well. But then you may also develop, depending on different body tissues, hypersensitivities. Like I said, where those mast cells become hypersensitive. Things like mold, heavy metals, mold toxicity, Lyme and its toxins can trigger that mast cell activation syndrome. Mast cell activation syndrome then can even take a little bit of its own life upon itself, where it's doing things outside of what Lyme or mold or those metals are doing. Once it does, patients need some control therapies. Yes, we always want to treat for the root cause to try to stop the process, but mast cell can take a life of its own on, such that you do need some medicines that control histamines and the other mediators, messengers of the process. Now, with that, there is a long list. And it's not that any one or two or three things are guaranteed for everybody to work, but it's more of each person has different triggers, and each person has a different process going on, such that each patient needs a little different therapy. So what we do is, it's more of an approach. We do have a list of therapies that we try, from natural to pharmaceuticals, kind of starting with the naturals, if at all possible, things like quercetin, N-acetylcysteine, NAC, curcumin helps, alpha-lipoic acid, vitamin D, vitamin E. There are natural therapies there that can lower that. Chondroitin is another one, Kela, an herb. But the other aspect is, it's not just throwing all those things on someone at once. It is starting one, seeing how they do for at least a couple of weeks. Everybody's going to respond differently. Quercetin is usually one of our first go-tos, and then it's very effective, but we have a few people who either can't tolerate it or it doesn't help lower the histamine as stabilizing, and it works by stabilizing those cells so they're not as sensitive. They do not put out as many mediators. If that doesn't work, we work to the next thing. Or we will optimize though the dosages of that. You may start at 500 twice a day, but actually find that 2,000 in a day is what works, not just 1,000. But we will keep adding. If something works somewhat, we will add to it. If we try something like quercetin or alpha-lipoic acid and there's no benefit, we may drop that, which is our usually process, and try something else. It may take a while, and you can still then also use some as-needed therapy. So if somebody's trying the natural, we may say, oh, until we get this under control, it's okay to use an antihistamine. Yes, there's a lot of scare out there about things like Benadryl at this point in terms of causing dementia issues. However, using that occasionally is not going to hurt. It actually can help in terms of knocking those symptoms down while we're waiting for the controlling therapy to have their full benefit. So with that, again, we work through a list of things until we can get a patient's symptoms under control while we're looking for root causes. For if we can get rid of those root causes, whether they're tick-borne infections, whether they're toxins, then often those mast cell symptoms will improve over time, and we don't need those long-term therapies, or you only need just a little bit now and then. Also, as a part of that, if there are specific triggers, say a specific food, a specific allergen, we will encourage patients to avoid that, whether it's dairy, whether it's grain. We'll also look if that's an immune response trigger, but there are also some foods that release histamine or contain more histidine, which is a precursor to histamine, such that we will sometimes have patients on a low histamine diet. With that, we will try to prevent their histamine load from causing them problems while we are, again, doing the other treatments. So with that, that's kind of the process of how mast cells, what they are, how they should work, how they don't work, what kind of symptoms they could cause, and some of the things we can do for patients who have those kind of symptoms. So with that, we're going to take some time to answer some questions in the time we have left. If you are interested, if you think you might have mast cell activation and want to get seen in our clinic at Sanctuary, we do have patient openings in January. Stephen at 615-815-5941 can help with that. If you just like to read some more, we do have a variety of blog posts on our website where we have talked about mast cell. And you can also look at our mold guide. We have a mold symptom therapy website that does have a short section on mast cell symptoms as well that you might want to look at. So with that, I'm going to look down at the questions that have been sent in, and I think there's been a few more come in since then. We're going to look for Ms. Carol. How can you tell the difference between mast cell activation syndrome and histamine intolerance? Or could it be a reaction caused by either withdrawal or side effect from a benzo? Or could it be caused by mold toxicity? So let's just take a moment to break this down into a few things. So mast cell activation syndrome is when mast cells are overactivated. Histamine intolerance can be associated or a separate issue. Histamine intolerance means histamine that is produced has an excessive effect. And that is sometimes due to the fact that either you have a genetic predisposition like HNMT or DAO SNPs that I talked about earlier, where the histamine you have stays around a lot longer, therefore having a longer duration of effect, such that it can build up and cause symptoms, not just locally, but if it gets into the bloodstream, it can have some systemic effects, even like anaphylaxis. So that's histamine intolerance and mast cell kind of overlap. So you really, the difference, it's hard to tell the difference because the symptoms are pretty much the same. We're going to look, if we know your genetics, we may say that the intolerance is more the bigger factor, but if we know you have mold toxicity, chronic inflammatory response syndrome, Lyme disease, we may say, oh, actually, yeah, there's a reason that's making this worse. So it's a fine line, and to some degree they overlap, and it's hard to tell the complete difference even with labs. Now, some of those symptoms, yes, could be withdrawal or a side effect from benzodiazepines, Ativan, Valium, things like that. Some of those benzodiazepines that are used for anxiety or for sleep actually have an antihistamine mast cell stabilizing effect. So they are one of the pharmaceuticals we will sometimes use in the short run in terms of someone's having mast cell symptoms, because they actually do stabilize that, and they get into the brain pretty well and can help with some of those brain-related neurologic mast cell symptoms. So if you're lowering off those doses, you might be uncovering some mast cell histamine symptoms that you didn't know you had. And then again, yes, it could be caused by mold toxicity if you're exposed, or if we're in the process of getting those toxins out of you with binder detox. On the way out, some of those toxins could trigger more reactions, and a lot of those overlap. So it is a step-by-step, one of the reasons why we really walk with patients through this process and not just send you out until you come back in 3 months, but we're helping you, week by week, kind of inch through the fog of recovering from mold toxicity or mast cell activation syndrome. And that really ties into the rest of her question: how you determine which it is, what it is caused by, and how it's treated. It is taking good history, looking at genetics if those are available, looking at lab tests. There are a series of lab tests. You can look at histamine levels, which aren't that helpful, tryptase levels if someone's having active symptoms. There's prostaglandin D2. There's also chromogranin A, some different markers that are signs of mast cell activity that we can look at. And then we can also look if someone's had biopsies inside their intestines, looking for a marker for increased mast cell activity. Another question was, and this actually touches a little on that, my son has had several endoscopies with biopsies done in his life. They have some eosinophils in his esophagus. Read one of the blog posts on your site that mast cells can be related to eosinophils in the gut lining with relation to mold, I believe it is said. Can you explain this a bit further, relationship between mast cells and eosinophils? Yes. So again, eosinophils are one of the cells involved in allergic reactions and also fighting parasites. They release histamine. They respond to IgE, and they can be a part of releasing histamine along with basophils and the mast cells. Other cells can, and just those are the cells that release the most amount of histamine. With that, if you are having increased mast cell activity, they will attract other cells. So your son, it may be having eosinophilic esophagitis, which there's an increased number of eosinophils, and then those are more sensitive to foods. So a lot of patients will have a lot of esophageal symptoms, from reflux to pain to spasms. It can be quite painful in response to foods that normally shouldn't, or to different temperatures. Had one patient that was even having some eosinophilic reactions to water when they would swallow. So the mast cells could be part of the initial, whereas eosinophils are the ones that are doing more of the acute symptoms. So we have to look at some of the biopsy reports to be more specific than that, but they could be related. Another couple of questions here. Are there underlying conditions that cause mast cell activation syndrome? So kind of like what I said, HNNT, histamine N-methyltransferase SNPs, DAO, diamine oxidase SNPs, both of those break down histamine and can predispose to mast cell activation or histamine intolerance, or severity of it at least. Mold toxins can cause mast cells to be hyperactive and hypersensitive. Lyme disease can do that as well. And then there's some other toxins from heavy metals, other things that can cause that to happen. The other thing, if you have leaky gut and your gut is not keeping foods out, those mast cells in the lining start being exposed to more things, and you can have more reactions from leaky gut. So those are some of the things that predispose to that. And then do people ever go into remission when their bodies aren't so sensitive? Yes, that's why it's important to remove that trigger. So that trigger, say mold or Lyme or some other toxin, has pushed that mast cell up to be a certain sensitivity. You remove that, that will settle down, hopefully back to pretty close to normal. but at least to a more manageable level. As long as that trigger that started the process off in the first place, though, is there, and its potential to at least stay there, if not keep worsening. And we've had some patients who, until we've been able to get those toxins or that Lyme infection out of the way, do worsen and require a few more therapies. But it's a process. It's more of an ongoing battle, a war, rather than just a single battle. But after we string a series of those battles together, we are able to help many patients recover from that. Now, I think I have another question here. Idiopathic hives, the daughter with type 1 diabetes had 3 days that appeared at bedtime. Mom also had it for a few months postpartum with only 1 baby out of 7 different ones. So let's break that down. So first of all, idiopathic, if you don't know, simply means doesn't have an explanation. That's what we in medicine call something like we don't know what caused it. But let's just treat the symptoms, which is not wrong to treat symptoms, but it would be good to try to look for some possibilities. So with that, idiopathic hives just means the urticaria, swelling, skin, rash, breaking out in type 1 diabetes and autoimmune disease. So with that, it could be mast cell activation. It could be leaky gut causing some allergens to get in that then go away that nobody ever knew about. The fact that mom had it for 6 to 9, months 6 to 9 postpartum. So our immune system for women, when you're pregnant, your immune system is suppressed a little bit, so that way you can have a baby inside you. With that birth and the drop of the hormones and changes, your immune system comes back online, which is one of the reasons why many women develop things like Hashimoto's or other autoimmune diseases postpartum. And if they have one of those, say like lupus or Hashimoto's, they often do much better during pregnancy because their immune system is suppressing that autoimmune process. So for mom, it could have been an autoimmune process where you're actually making some antibodies against mast cells and triggering that. It could be your immune system just revving up in general. Now, whether those two are related between mom and the daughter, without knowing your full story and without knowing if there's some common triggers, if you're both exposed to mold, both had Lyme, the fact that the daughter has type 1 diabetes, there's some immune system autoimmune issues there. Would have to dig a little further, but definitely mast cells are likely involved in those processes you're describing. Look at another question. Is there one specific natural therapy that works best to calm the mast cells in the brain and CNS, or leaky brain, which are triggering dizziness and headache? So, as I said earlier, different therapies are more effective than others in certain patients, depending on where your symptoms are. If you take a therapy that only gets into the gut and never gets absorbed, it's not going to help the skin or the bladder or the brain. If you want therapies to work in the brain, even though the brain may be leaky, by the same process and reactions that occurs in leaky gut, which makes chemicals easier to enter the brain, still you have to get those things in the bloodstream, and they have to be somewhat fat soluble because our brain is mostly fat. Don't take it personal, but your brain is fat and wet. That's mainly what your brain's made of. With that, though, we want to be able to get things in there. So there are some that do enter better. I talked about benzodiazepines, sometimes can be helpful. We try to limit that just because they do have addictive potential, and there's so much in the news today right now about trying to avoid addiction from using medications. But those sometimes help. We push up the dose of some other therapies that don't get in the brain perfectly. So use higher doses of quercetin, higher doses of curcumin, use those liposomal versions of that, or things like alpha lipoic acid, which is fat soluble. So it's not, it really gets back to there's not one best that's going to work for everybody, even everybody with migraine or dizziness or brain symptoms. Also, some of that dizziness could be more peripheral, more ear-related. So it's not about getting into the brain, it's more about getting it into the ear. So we basically we try to make our best guesses, estimates of what therapy is going to work best for one person, but then we work through those until we find something that works. I get it for patients that, oh, I can't, I've got to try this for 2 weeks and then try something else for 2 weeks and try something else for 2 weeks. And it may be, yes, it may be a series before we know, but also I don't want to put somebody on 10 things, and I could, and then say, oh, I'm better. Like, well, which one is it? Well, then we could back off and stop one at a time, but it is better if we can pinpoint that going in than kind of jump in the deep end and try to work our way out. So to some degree, there's not one best thing besides getting rid of the trigger if you can find it, like I said, mold or Lyme, but those are the way we approach those things. So then another question from Amanda is, once the root cause is determined, how long does it take for someone to recover from mast cell activation syndrome? Kind of built on, once the root cause is determined, it somewhat depends on how long it takes to get rid of that root cause. If it's mold toxicity and you're still in a moldy environment, home, work, school, church, whatever that may be, really the clock doesn't start ticking very quickly until you're out of that. Or if you have Lyme disease, yes, it may take 4, 6, 9, 12 months to get your Lyme disease under control. And then we start looking, oh yes, things will get better as that goes away, but it's okay. Let's try this again. Part 3, as we're looking at technical difficulties that I still don't understand, and we'll pray that don't plague us anymore until we finish the questions that we have left. But I was trying to answer a question that I will just start again for Amanda. Once the root cause is determined, how long does it take for someone to recover from mast cell activation syndrome? Well, that depends. If it takes you 6 months to treat that root cause that's been determined, it's going to be at least that amount of time. You may see improvement and even maybe significant improvement, but it might be another 3 to 6 months after that before you really see the mast cells truly settling down. But again, you'll be better, but you may still have to deal with mast cell a little longer after that. So hopefully that gives you at least a better sense, because it really depends on how long that is. And as I said before, if your mold is the trigger and you're still being exposed to mold, the clock really doesn't start ticking very well, if at all, until you've gotten away from that trigger. So another question, Carol, can it cause your teeth and jaw bone to hurt? And can it cause anxiety to be worse? So first of all, the teeth and jawbone, histamine, again, can irritate peripheral nerve such that it can cause some ongoing pain. It's usually a little more neuropathic, but if that swelling that it's causing is happened to be nearby a nerve, it can cause some more of the dull pain that's a little neuropathic, being a little more stinging, tingling, burning kind of pain. But you can have some other baseline dull, achy kind of pain as well. So it is possible, especially with the cranial nerves, if you're getting histamine affecting the brain from mast cell activation, it can cause some pain syndromes. For anxiety, yes, if the mast cells are being hyperactivated in the brain, it can cause some inflammation. Inflammation in the brain can cause anxiety or depression. It can trigger some electrical activity that could be triggering anxiety, panic attacks, and definitely have some mood effects. So that definitely happens. We have one more. Yep. So far, if anybody has any more before we wrap it up. From Amy, how do you know for sure it's mast cell activation syndrome? And the symptoms could be caused by so many different things. So as I mentioned before, there are some tests, but the way I like to describe it, if you saw a cow on the side of the road coming up ahead and you're driving down the interstate at 65 miles an hour, and you pulled out your camera, rolled down the window, and you're going to try to catch that picture of the cow 10 feet off on the curb, while you drove by it, you're going to have a really good stop camera and also a good catch, because you're more likely to miss it. And that's kind of a little bit what catching the labs for mast cell activation are like. So if someone's having episodic and you can catch them within a few hours after their episode, obviously if it occurs at 11 o'clock at night, it's a little harder to do that. You can do that till the next morning unless you're going to the emergency room and you can convince them to do some of those labs. But if somebody's having ongoing symptoms, sometimes those lab levels never get high in the first place. But there are a number of things that you can do. There's some blood and urine. The other difficult thing is, besides having to time those tests at the right kind of during or soon after symptoms, some of those tests are hard to do in terms of being frozen, and there's some gray zone in whether they're truly high or not. We do try to catch those if somebody's having episodic symptoms. That will give us a true sense, and also if that patient has to interact with the conventional medical system, they're going to say, oh, you do have a disorder, rather than, oh, not just based on symptoms. Now, from my end, if I see a patient with those symptoms, it fits with the description, they have triggers, they have the right symptoms, I'm going to treat them like they have that, even without the test, because I know and we treat them with therapies that help histamine and mast cells, and they get better, that's a pretty good indication that's what it was. But your other question just about how do you tease out when there's 2 or 3 or 4 different things causing overlapping symptoms, sometimes you don't. So you treat what you know is there, and then treat other things, and we try to work towards all those symptoms being gone. Regardless, yes, it's difficult and not always perfectly possible, but that's what we aim at as much as we can at Sanctuary. So I think that is our questions for the day. Apologize for all the technical difficulties. I have no idea what happened with all that. But if you have other questions about mast cell, as you're watching this later, leave them below and we'll try to get back to them. And also, just to let you know, we're going to do a little lighter Facebook Live, December 12th. It'll be Mold in the Holidays, about traveling with mold toxicity and how to be as safe and healthy as possible when you're visiting family and friends to avoid getting sick or having a relapse. And then we'll be thinking about our 2020 Facebook Live season heading into January. But those are dates and topics are yet to be determined. But for now, we'll end the year on December 12th. Look forward to seeing you then. Please leave your questions and give us a call if you need our help. Blessings.